My name is Dr. John Hilinski. I'm a board-certified facial, plastic, and reconstructive surgeon. I practice in San Diego, California. I was educated at Harvard Medical School. I did my residency in head and neck surgery here in San Diego, and then I did my plastic surgery training in Chicago under Dr. Dean Toriumi. So I specialize in primarily facial cosmetic surgery, and within that specialty, I happen to do quite a bit of cosmetic ear reshaping, primarily otoplasty and macrotia surgery.
My name is Molly, and I found out about Dr. Hilinski through a lot of web research that I had done. I've been a patient of his for about a year now. I started out by looking online for just ear surgeries. I had only heard about ear pinning, but never about the full surgery.
It is an operation that can be incredibly impactful on your life if you have ears that are simply just too large for your desires. And for those patients that are bothered by this on a daily basis, for patients that are constantly worried about people staring at their ears, for patients who shy away from public appearances or even career paths because of the size of their ears, I will tell you there's an operation out there. It's macrotia surgery reduction, and it works, and you can have incredible results from it. Macrotia surgery is actually very distinct from otoplasty. Otoplasty is the most common type of cosmetic ear surgery that you will find online or researching doctors. Otoplasty is an operation that is intended to pin the ears back. It makes the ears appear smaller in size, but they aren't necessarily smaller in size. Even though there is some removal of cartilage in some cases of otoplasty, the main emphasis of that operation is to make the ears look smaller by bringing them in closer to the side of the head. There are quite a few patients who realize, unfortunately, after having otoplasty that their ears are still large in size.
I had done ear pinning about 12 years ago that I was not happy with the result, more just because it didn't really work. It didn't really take. So I had come to him to kind of see what we could do.
Macrotia surgery actually involves making the ear smaller in size. We're taking an ear that is, let's say, 6 to 7 centimeters in size, and we're reducing that by 1 to 2 centimeters in some cases, making the ear overall actually smaller in size. So from top to bottom, vertically, we can remove the top part, which is called scapha reduction, and then along the lower part of the ear, we can reduce the size of the earlobe, which is essentially earlobe reduction. And when you combine those, you can have a significant impact in terms of making an ear smaller in size and much more proportional to the shape and the shape of the patient's face.
It was something that I had always noticed about myself. No one had ever pointed it out to me or anything like that, but it was something that I was always really self-conscious about. I never wore my hair up. I would never look at anyone head on. I would always have my head tilted. Things like that. And so I thought, if there is an option out there, why wouldn't I, kind of thing.
I think most people don't realize that macrotia surgery exists because if you do an internet search, which is one of the primary modalities for patients seeking out surgeons nowadays, you don't find much information out there unless you actually research the term macrotia or scapha reduction. That's one of the main reasons why patients don't realize that they need this operation and not necessarily ear pinning.
So I thought that it was that they were, just kind of a little out more. And after I met with Dr. Hilinski, he just looked at me for 2 seconds and he's like, that's not your problem. More it's the size.
Macrotia surgery is very uncommon. It's very rarely performed in the world of plastic surgery just because there are so few surgeons out there that are performing it. As far as I know, I am one of, if not the only, plastic surgeon performing this on a very regular basis in the United States. And testimony to that is the fact that we have patients that literally fly in from all over the world to San Diego to have me make their ears smaller in size. There just aren't surgeons here in the United States that have the experience and the knowledge to do this consistently. And the patients that find us sort of confirm that same story. When we perform the operation, we carefully mark the upper part of the ear, is called the scapha. We place the incisions along the inner lining of the helical rim, which is the outer border of the ear. And the reason we do that is so that we can hide and conceal these scars so that they're least visible as possible once they heal. At some point along the helical border, we do have to make an incision across there, which allows us to remove the excess skin and reshape the ear so that it looks natural and normal. But we do the measurements first. That's very key in this operation. It's also important that we mark out the new shape of the ear, because it's not just about reducing the size, it's also about reshaping it. And so it's very important along the scapha area that we contour the ear with a natural curvature, which is why you'll see in some of these markings that there's a natural curve across the top. Macrotia surgery is very safe. In a great majority of the cases, we're performing this under local anesthesia, where patients do not require IV sedation or general anesthetic to have the operation completed fully. And so in that sense, it's very safe. Initial recovery involves wearing a bandage around the side of the head, which we place at the conclusion of the operation. Patients will typically wear a bandage for upwards of about 72 hours. In some cases, we can remove it a little bit earlier.
You know, just the surgery itself is so easy to have such a dramatic outcome, and it's so quick. You can see the difference right away, which is really exciting and awesome. Having something on your body that you're self-conscious about, it's always on your mind, you know, it's always kind of there. And if there is a way to fix or change things to make you a little more happy, it's worth every single second of doing it, absolutely. Would I do it again? Hands down.
Knowing that I can have such an impact on someone's life who's been bothered in some cases their entire life by ears that are too large for them is incredibly rewarding.
The fact that I can wear my hair up in any way that I want to now is so nice. Wear it back in a ponytail without being uncomfortable and self-conscious. Being able to look someone head on and not worry about the angle of my head or how I'm looking at them, or thinking that all that they're looking at are my ears instead of my face or what I'm saying.
Even though I'm treating patients and those patients feel great about the results that they get, I am also incredibly rewarded by the outcomes that I see and the impact that those outcomes have on patients' lives.
Changed my life in a lot of really different ways that I guess I didn't even really notice until after I had the surgery done.
So that's what drives you? That's what drives me.